What we cover in there is what is the relationship between the pelvic floor and these structures with which probably most of the attendees are fairly familiar. How do they impact one another? So why would we maybe want to consider a spine manipulation for a patient with a complaint of incontinence? How can we cue exercise, and how can we integrate this sort of physiologic knowledge of pelvic health in order to make sure that when we are helping our patients rehab from their chronic low back pain or post-op total hip replacement, that we are treating and referring to the entire area and not sort of just ignoring this one over here. There have been multiple studies actually that have come out lately. The one that I find the most compelling came out a couple of years ago. And what they found was that, so they took a group of people who are assigned female at birth who had chronic low back pain. They found that 98% of them had at least one symptom of pelvic floor dysfunction, be that incontinence, constipation, difficulty with other bathroom functions, or pelvic pain. And so to me, I mean, that did not surprise me whatsoever, because that is also what I've observed clinically. But that's pretty compelling to say that if you are in orthopedic practice, you actually are already seeing patients who have pelvic floor dysfunction. You just may not know it because you may not be asking them those questions. And they don't necessarily have a reason to bring it up, because our patients are not going to connect the fact that they leak when they jump on a trampoline with their low back pain. And so that's where I think the onus is on all of us, really, to have at least a baseline understanding to where we can screen and go, you know what, I think you need to go see a specialist, or no, this is somebody that I can handle. I'm just going to include some kind of personalized cueing to make sure that we're getting that pelvic floor component somewhat addressed.